Wants people to recognize those early signs and symptoms of the disease in their loved ones. In fact, new data reveals for the first time ever, there are more than 7 million Americans who are living with Alzheimer's. And joining us now with more on that new data and about those warning signs we need to watch for, we welcome Dr. Carl Hill of the Alzheimer's Association. Doctor, thank you so much for being with us here on 7 News.
Oh, thank you so much for having me, Megan. Happy to be here.
Of course, it's such an important topic. First, we mentioned that new data. Doctor, tell us what it shows about Americans who are living with Alzheimer's right now, and even more interesting, how that number is expected to grow in the coming decades.
Yeah, Alzheimer's is the sixth leading cause of death among people aged 65 years and older. We estimate that the lifetime risk for Alzheimer's dementia at age 45 is approximately 1 in 5 for women and 1 in 10 for men. And by 2060, the number for people aged 65 years and older with Alzheimer's dementia is projected to double, to 14 million. So we've got work to do.
Oh, those numbers only expected to grow. We need the support, the resource. And doctor, you say close family members, that they're the first to notice signs of the disease. Understandably, please tell us what are those signs and how they differ from even just the normal signs of aging, especially in those 55 and up that we start to see.
Yeah, early warning signs can include having trouble following a familiar recipe or keeping track of monthly bills. Anytime you see a loved one struggling with familiar tasks or frequently forgetting important dates or names, it may be a sign for you to have a conversation. And that's why the Alzheimer's Association is excited to partner with the Ad Council on a new campaign, Some Things Come with Age, urging people to learn the early signs and symptoms of Alzheimer's disease and other dementias in their loved ones, which, as you mentioned, can oftentimes be mistaken for normal signs of aging.
So important, doctor. You mentioned the campaign that's been in place, Some Things Come with Age, and then the new messages you hope to spread. Tell us a little bit more about some of the messages you want to get out there, you want people to know.
We want people to know that first there are resources that are available, right? And so at 10signs.org, there's just important information about distinguishing these risk factors from normal signs. Your information and resources about how to have conversations with doctors and family members, and just general information about Alzheimer's and dementia that we think are really, really critical at this time. So we're driving people to 10signs.org to look at our PSAs. They will be far and wide in the coming weeks, months, and hopefully over time on TV, radio, billboards, bring people to more resources so that we can address this public health crisis.
The resources are so important. And doctor, you're no stranger to data and numbers. And I think sometimes we forget those are people. And we want to talk about the rates of Alzheimer's for Black Americans specifically. How do those rates, doctor, differ from the general population?
Well, Black African Americans, 2 times more likely to have Alzheimer's or another dementia. Genetic factors don't appear to be driving this elevated risk. We've got to get people information. The life experiences, socioeconomic indicators, and then disparities in cardiovascular disease and other cardiovascular health outcomes could be driving this. So Black African Americans, need information in ways that are useful and effective, which means that they see themselves in the messaging. That's health equity. And the Alzheimer's Association and the Ad Council are just excited to collaborate to provide this kind of information in a way where people see themselves, and it could be used effectively so that people can get the care, support, and treatment that they need and deserve.
Absolutely, and we know there is no cure yet for Alzheimer's. Someday we would love to see it, but we know early detection is critical, like with anything, doctor. Especially why is that so important when it comes to Alzheimer's?
Well, for the first time, there are disease-modifying treatments, not a cure, but it slows that cognitive decline, giving people more time to make decisions, more time with their loved ones. But the caveat here is that they are effective in people at the early stage of the disease, right? And so if you miss that window, then you miss the opportunity to take advantage of these disease-modifying treatments. And so knowing the signs, being able to have a conversation with family members about getting a diagnosis is so important so that people can have access to these treatments in a timely manner. And that's why people should go to 10signs.org to become updated and take action.
Easy as that. Dr. Carl Hill of the Alzheimer's Association. Doctor, thank you so much for being with us here on 7 News at noon.
Megan, thanks for having me.
Thank you. So important and a great reminder today. Hey, stay with us.